Debriefs, how to run one. Much of the information we will be discussing today comes from the Mental Health Commission of Canada's report, Assembling the Pieces, and the Canadian Patient Safety Institute's report on creating a safe psychological workspace, both of which focus on the creation and maintenance of a psychologically safe work environment for people working in areas who are at a high risk of generating or exacerbating psychological morbidities. Healthcare environments being close to the top in terms of risk. Just as a firefighter is expected not to be overwhelmed by the size of the blaze, healthcare clinicians are expected to not get swallowed up by the traumas we help people through. We are knowingly going to be involved in a lot of situations people should not be expected to be okay with. Let's start by defining what a debrief is. It's one of those words that we all know what it means, probably to varying degrees. So defined, debriefs are interrogations, that's a dictionary's word, not mine, in order to obtain useful information post-mission. Debriefs originate as interrogations, which is most likely why they come across as one. So how have we adapted debriefs out of the interrogation style? Debriefs can be done in a variety of ways. Many still follow the same 3-point system in this very specific order: venting, discovery, growth. Venting, it does two things. One, it helps set the tone for what will be discussed in the debrief. And two, it allows people to work through some of the pent-up emotions they may be experiencing post-event. Venting can look a lot like people complaining. Venting often is just people complaining. That's fine. That's expected, in fact. Venting is not logical. Venting is not rational. Venting is very emotional. It's a big barrier to leading a debrief, having to coordinate all these high-level emotions. It's the same level of frustration as trying to coordinate your intoxicated friends at the bar at closing time, in that there's a lot of emotions that we're going to need to navigate through. And this highlights why the first rule of venting is so important. Venting is not solution-focused. Why is venting not focused on solutions? Because I don't want solutions right now. I want to be angry, and I'm going to do everything I can to stay angry. During stage one of our game as leads is to identify the themes. We look to identify key problems in just the sea of venting. We want to see what comes up over and over and over again. While we're doing this, we're also simultaneously helping everyone involved and everyone debriefing regulate themselves back to their rational and logical states by allowing them to vent freely. This is why venting is always step one. As people vent their feelings, a clear transition into phase two, the discovery phase, is when the person leading the debrief or the group themselves highlight a consistent theme and the group begins to analyze it. Now, discovery is about reviewing what just happened, removing our biases, and analyzing the event. To lead a debrief, the barrier here, it lies in analyze versus assessment approach. Now, let me pause here for a second. I'm going to put on my pedantic hat here, and I'm going to explain the difference between analysis and assessment. In an analysis and an assessment, they're often the same work, but the key difference between the two is staying out of judgment. An analysis seeks to understand. An assessment seeks to identify a cause or effect. An analysis is open, an assessment is closed. Step 3 is growth. Growth is 3 parts. This is our assessment now, follow through, and conclusion and validation. So first, our assessment. This is where we capture our, what went well, what went wrong, what got in our way. This needs to be asked more, but is our goal appropriate? That's our assessment that we're going to go through. Those are the 4 main questions that we usually attach onto it. Second is the follow through. We follow through on any actionable items discovered that could improve the situation if it were to happen again. And lastly, to conclude the discussion, we want to normalize what was discussed. This helps prevent people from that vulnerable oversharing feeling. And this isn't for people leading either. Anyone attending can normalize the conversation, reminding that people that what they're feeling is fine and at times is expected. It would be weird if you didn't feel that way is a good line to have in your back pocket whenever you're leading a debrief. So to reiterate very quickly, stage 1 is venting. As we spoke about earlier, we don't worry about solutions right now. We don't want solutions from people who are tense and anxious anyway. Those won't be our best solutions. During this stage, we need to actively listen so we can navigate through the venting to identify themes. Our game is to sit and listen. Venting allows people to express some pent-up emotion. It helps us return to our more rational and practical selves. That if held on to, turns toxic almost, sort of like trying to do something when you're hungry. The results are going to be impacted. And luckily, most times, people leading debriefs don't really say much between introductions and stage 2 of the discovery. So then we go into stage 2 of discovery when we got to do a bit more here. We want to stay in our analysis mode and be wary of drifting into the assessment just yet. A fantastic tool here is using how questions instead of why questions. Why? Well, questions starting with why are often received as a challenge. They either elicit overly intellectual responses, including numerous details regarding insignificant or mundane aspects of the event, or just minimal responses. It's not the detailed narrative that we're looking for right now. Staying in analysis mode helps us stay out of bias, and our questions will provoke a challenge to discover instead of challenging a defense. And stage 3 is growth. We want to ensure that there's follow through based off any actions that we had discussed that might be beneficial. This is what builds trust to the next debrief. We want to normalize what was discussed during the entire event to ensure that people leave with a positive feeling versus a judgmental feeling. And 3, leave contact information for the person who wanted to ask something privately. As the majority of the time, there's at least one. With all this, it's weird that we don't debrief more, isn't it? I am speaking to people specifically in healthcare at this moment. There's a lot of other professions that should be doing the same thing, but anecdotally, no one does it. So why don't we? 2 reasons. First, who is leading the debrief? People in real or perceived positions of power, that it will impact communication. Second, the things we will debrief about are going to be tough conversations that usually elicit some sort of negative emotions. Who leads a debrief can dictate what is and is not discussed. So if you're a senior manager, a director, a manager, a CEO, anybody in a position of power, understanding right off the bat that because of the position, people will have the perception of your power, rightly or wrongly, that will impact what and how they express themselves. Look at it this way. Say we're driving. We're cruising. We're not speeding. We're just cruising around. We literally have cruise control going. And as we come around a bend, we see a cop car parked just out of our view. What do? We slow down. Why? Because of the power that we perceive that officer to have. This barrier has nothing to do with the individual leading the debrief. It has everything to do with how people view them. And it isn't limited to management or leadership. If people perceive you have influence over them professionally, emotionally, physically, communication will be impacted. So I just want to be clear here. This barrier isn't anyone's fault. It's just a roadblock that is commonly seen right off the start of a debrief. Aside from finding the most trustworthy person to lead a debrief, it's just an obstacle that we need to uniquely plan around. Second, the tough conversations. A personal example I have with this is working with eating disorders. While working, we had staff come and support us during our patients' nasogastric or NG feeds. Now, NG feeds are tubes that go up your nose to your stomach, and we pump in usually onshore, and that just helps make sure nutrition is adequate for the day. It sort of feels like having a COVID swab, but like much worse. So we quickly ran into a dilemma where staff became less and less available to assist us, and we thought we understood the problem as a workload issue. People were just too busy to come and assist us. Myself and another staff, though, we felt it might have more to do with the NG feed itself. I won't go into exactly why, but they were never something easy to be a part of for the staff or the patients. We found a few interesting things. The largest and most immediate issue we found was staff often left feeling dirty, was the word that came up most. Often another staff member put this a little bit more succinctly, saying It was difficult to walk away feeling proud of themselves after assisting us. I think that this is clinically known as the icky feeling that ethics talks about. Now, let me just say, I don't know much about having an eating disorder, but I do know that it's an incredibly frustrating and high maintenance mental illness to have. Patients were often well aware of the food they needed. They just can't. Much of the time it was dealing with the intolerable amount of guilt that they felt after eating. So some, well, they found workarounds. One popular way to circumvent that guilt post-meal was the use of restraints. Some patients requested the restraints openly because the restraints acted as a sort of mechanism to bypass the guilt of shame, or the guilt or shame from eating. Can't blame myself if it wasn't up to me, right? It helped keep their eating disorder thoughts to a more manageable level post-meal. It's not a solution. It's more of a band-aid while they learn to tolerate whatever feeling they had post-meal. It was meeting them where they were in their treatment. They didn't have the resilience to manage these emotions yet. It did not make seeing someone go through the NG any better, but that context helped a lot of the staff helping us leave feeling a lot less dirty. And we learned all this when we implemented structured debriefs. These debriefs offered the assisting staff a moment to vent prior to returning to their other tasks, and it offered a natural chance to ask any kind of clarifying questions for any unique ethical dilemmas that they might be experiencing to someone very familiar with the context around that patient's plan of care. Debriefs don't solve the problem for anyone. Debriefs just make us stronger to challenge these problems again. Debriefs help us get back up after being knocked down.